আমার দেখাচ্ছে না আমার ইসে চলতেছে কই আমি তো দেখতেছি না। হ্যাঁ রুবেন্স, হ্যাঁ তো হ্যাঁ হ্যাঁ, ওই আচ্ছা ওই আমি তো ওই যে ওই ওয়েটিং রুমে আছি ওই যে ওইখানে তো এটা করতে পারতেছিলাম না তো আচ্ছা, ঠিক আছে। হুম, ওই
এই যে লাইভ গোয়িং অন 58 সেকেন্ড হয়ে গেছে, ওইটা আপনি রিপ্লে দেন, আমি আপনাকে দেখাচ্ছি আমার
এটা কি করার মানে স্টপ করারই আছে কোনো? কোথায়?
লালটাতে
লালটা দিলে তো একদম স্টপ হয়ে যাবে, মানে এটা পুশ করারই কোনো নেই। আচ্ছা, হ্যালো, নাকি ওরা মানে শুনতে পারবে?
শুরু করে দেন।
না শুরু করে স্টপ করারই আছে। কে কে পার্টিসিপেন্ট আছে এটা কিভাবে করে দেবে?
যে কমেন্ট করবে এখানে, এখানে দেখতে পাবে।
শুনতে পারবে? আচ্ছা,
এখানে হলো লাইট যদি
হ্যাঁ
চলে যায় লাল, মানে আমি পাশের রুমে আছি, যদি প্রবলেম করে আর কি।
হ্যালো, today I am Dr. Apurva Kishore Pal. Today I discuss short case lipoma. What is lipoma? It is a benign connective tissue tumor arising from the adult fat cell, and it is commonest of the all benign tumors. And this is the commonest tumor of the subcutaneous tissue. It may occur anywhere in the body, hence it is known as a universal tumor. Today I discuss short case lipoma. আচ্ছা, এটা করা যায় কিভাবে? মানে আমি এই যে লাইভ যেটা হচ্ছে সেটা দেখার benign connective tissue tumor arising from the adult fat চলতেছে cell. না? And it is commonest of the all
এখানে
benign
দেখুন
tumors.
লাইভ লেখা থাকবে।
হ্যাঁ,
This
this is the commonest tumor of the subcutaneous tissue. It may occur anywhere in the body, hence it is known as a universal tumor. The commonest sites mostly seen in the subcutaneous tissue. আমার ভিউটা দেখা যাবে? হ্যাঁ হ্যাঁ। মানে আমি live যেটা হচ্ছে সেটা দেখার আচ্ছা। Mostly seen in the subcutaneous tissue about the back of the neck, shoulder, and the back. Varieties of the lipoma. In relation to the processing of a capsule, it is a encapsulated lipoma. This is the commonest variety. It consists of normal fat which contain overactive fat cells and is arranged in the lobule separated by fibrous septa and enclosed in a delicate capsule. This is a true lipoma. Other variety, diffuse variety. This is quite rare and does not possesses the typical features of lipoma, hence it is often called pseudolipoma. Another, multiple lipoma. it is often called lipomatosis. The tumor remains small or moderate in size and are sometimes painful as they contain nerve tissue and is called neurolipomatosis. These are mostly seen in the limbs and in the trunk. Lipomata is a different size and shape may be seen. Darkham disease or adiposis dolorosa is a variety of this condition in which there are tender lipomatous swelling, particularly affecting the trunk. Classification of lipoma. Anatomical classification depends on the anatomical side. Subcutaneous lipoma, this is the most commonest variety. Others are the subepidermolytic or subfacial, intramuscular, subperiosteal, subsynovial, articular, interarticular, submucous, subserous, extradural, and intragranular varieties. Histological classification depends on the presence of other tissue in addition to adipose tissue. The fibrolipoma, the mixtures of fibrous tissue and adipose tissue. Another neurolipoma, mixtures of hemangiomatous and adipose tissue. Neurolipoma, mixtures of nerve tissue and adipose tissue. Clinical classification. Clinical classification is a sessile variety and another one is a pedunculated. The difference between sessile and pedunculated, this is a stalk presence between the skin and lipoma is a pedunculated, and no stalk is a sessile variety. This is a upper one is a large lipoma over the back of the scapula. There is a no stalk. This is a sessile variety of lipoma. Another is a long stalk between the skin and lipoma is a pedunculated lipoma. Diagnostic criteria of the lipoma. Any short case when we are diagnosed by 4-step: first inspection, palpation, percussion, and auscultation. So, the first the most commonly lipoma are present at the site, mostly back of the trunk, neck, limb. Then we go through a surface. Surface is mostly the surface is surface is over in case of subcutaneous lipoma is the surface like a skin. Then palpation surface is the painless, soft, solid swelling, and surface is lobulated, and lobule can be seen and felt on the surface and at the edge of the lump, and which most prominent when the lump is squeezed between the two finger, then there is a irregular in the surface and the around the edge. Which means the lipoma is a lobulated, and the overlying skin is a free, and edge is well defined and maybe a series of irregular curves corresponding is lobule, and sleeping sign present. Which is sleeping sign? Sleeping sign when finger pressed over the edge of the swelling, and the lipoma, the swelling was slip away from the finger. This is called the sleeping sign. It means the swelling was freely mobile from the skin and underlying structure, and it is freely mobile on both axes, vertical and horizontal, and fluctuation test negative, translumination test negative. Fluctuation test means it is a fluid or another tissue was present. How the fluctuation test we are done? In case of a small tumor, the two finger or place in the between the center and axis of the uh, edge of the soiling, and press. If the fluctuation test is positive, then we feel the movement on the another finger, and it must be examined in two direction, in horizontal and vertical direction. Another transformation test positive. Transformation test where present, there is a transparent fluid present in the soiling, but in case of lipoma, no fluid and which is not transparent, so transformation test negative. This is a large lipoma in the lateral chest wall near the posterior axillary fold. This is a figure of sleeping sign, how to elicit the sleeping sign. Complication necrosis due to repeated trauma. The lump become hard and painful. Another complication is calcification, hemorrhage, infection, really malignant liposarcoma, myxomatous degeneration, and ulceration. And sometimes, in case of pedunculated lipoma, torsion may occur. This is a uh, uh, pedunculated variety of lipoma. There is a narrow stalk, and there is a whitish discoloration over the lipoma due to repeated trauma, causes ulceration and fibrosis occur. Treatment. Treatment is a excision if large and unsightly or troublesome. This is a operative view of excision of capsulated lipoma. Was present. Thank you. This is all about the lipoma. Another short case, dermoid cyst. What is dermoid cyst? It occurs due to sequestration of the epithelial elements deep to the skin surface. This cyst generally develops in the line of embryonic fusion. Clinically, four varieties of dermoids are recognized: sequestration dermoid, implantation dermoid, tubulodermoid, and teratodermoid. What is sequestration dermoid? It is a two variety of congenital cyst arising from the primitive ectodermal cells being buried at the line of embryonic fusion. The cyst is lined by squamous epithelium and contain paste-like desquamated material. origin. During embryonic fission, is few ectodermal cells are sequestrated into the deeper layer, into the surrounding mesoderm. Later on, this cell proliferate and liquefy to form cystic swelling. Sites usually at the midline of the body, especially in the neck, at the root of the nose, on the skull, at the inner or outer angle of the eyes. This is the midline swelling. So it is a dermoid in the midline sternum. It may extend in the deeper plane, so it needs CT scan or chest evaluation. Pathology: lining of the dermal cyst, the squamous epithelium, and would contain hairs, hair follicles, sweet and sebaceous gland, and it contains toothpaste-like desquamated material with or without hairs. The paste is a mixture of sebum, sweet, and desquamated cell debris. What are the diagnostic criteria? The most important diagnostic is the site. It is usually in the midline swelling at the line of fusion, and it is painless lump, ovoid or spherical swelling, surface is smooth, skin can be lipped up, absent of punctum, cystic swelling fluctuation positive, not compressible, bony indentation present in relation to bone, impulse on coughing or staining usually not present except in the scalp dermoid. Transillumination test negative. Uh, this is a external angular dermoid. This is the site of external angular dermoid. This is the site of internal angular dermoid. This is a external angular dermoid. This is a internal angular dermoid. This is a post-auricular dermoid. This is a post-auricular dermoid. This is a post-auricular dermoid. Complication. Complication usually occur infection followed by suppuration, and it followed by the busting and ulceration, and the and cosmetically look ugly. Treatment: excision is advised to prevent complication of or for cosmetic reason. Acquired or implantation dermoid cyst: a cyst from after the survival of a piece of skin forcible implanted into the subcutaneous tissue at the injury, such as small deep cut or stab injury. the patient might not remember the injury. The histology is similar to the congenital dermoid. Site occurs in areas subject to repeated trauma, such as finger, so tends to be trouble, interfere with function, and can become painful and tender. This is the implantation dermoid in the base of the dorsolateral aspect of the finger. This is the another implantation dermoid in the about the dorsal aspect of the finger, and this is a, implantation dermoid in the lateral dorsolateral aspect of the little toe. It confused with a sebaceous cyst, but the presence of a scar and history of an old injury is helpful in diagnosis. Management. Management is the excision of cyst. This is the implantation dermoid cyst, dorsal aspect, ventral aspect of the toe, finger. Mm. Possible question you may get during exam. The first, assess this lesion or lump. What is this? And perform the test for fluctuation, indentation, or another anyone. These types of question may arise during examination. Examination of a superficial lesion. First, you introduce yourself and ask permission to the examiner. Inspect with patient in good light from front and side, and look without touching. Comment on the site, size, shape, skin surface, scar, and ask. And when you palpate the soiling, first you ask about the pain first, then assessing the temperature using the dorsum of the hand, palpate gently and assess tenderness, look at the facial expression, ask if tender, feel the edge of the lesion, look for the slip sign, smooth edge, slip away from the finger in lipoma, the feel the consistency of lump, the soft, firm, hard, cakey or bony or stony hard, and test for fluctuation. And assess the layer which the lesion is arise. It is continuous with skin or underlying, and it tethered to the muscle. If it within the muscle, when you uh, uh, move against movement, it is more prominent and less mobile. And examine for the regional lymphadenopathy. To complete the examination, examiner say, would you would also like to take a history of the lesion, onset, duration, recent change, other lesion, history of sun exposure, family of the skin lesion, and other effect on the quality of life. Then you give the thanks the patient. Is due to the all about the short case, the lipoma and dermoid cyst. If any comment, please in a comment box. Thanks. কি করতে হবে এখন?